As we continue from the National World War I Museum and Memorial on Veterans Day, we are so happy to welcome on Lauren Lucht, Executive Director of Mental and Behavioral Health for the University of Kansas Health System on KCMO Talk Radio. Lauren, thanks for being here. I know that you are a big supporter of the Battle Within and a big fan of what they do, and you have played a big role in helping them launch their Frontline Therapy Network, which really started at the beginning of the pandemic over 2 years ago now. So how did your role fit into what the Battle Within was doing, and how did this Frontline Therapy Network get started?
Well, I think it was really magical. And let me just first say thank you so much for having me on and for letting us talk about the Battle Within story. They reached out in the beginning of the pandemic, and what we learned after a conversation was that our frontline heroes and in healthcare and the frontline heroes in our community and for our country weren't experiencing entirely different things. We were seeing on the front line people struggling with, reactions to seeing traumatic things, not having as much support as we would want to talk about those things. And so, as the Battle Within was flipping to a model where they could help all types of first responders, we wanted to make sure that people working in healthcare had access to that. And I was an easy target because I am a huge proponent of treatment and care for people who are struggling with PTSD and first responders, of course.
So what made the Battle Within, Lauren, different in terms of you wanting to get involved, you wanting to give back to a veterans group here in Kansas City, and how did that connection come to be?
Well, I would say that they lots of reasons, but mostly I enjoy the approach that the Battle Within has taken. So they are completely nonprofit. They are looking to support first responders and other heroes who are struggling, and there is no cost to the patient at all. And what they offer is a very unique type of program that patients wouldn't be able to find elsewhere. And it's their model that really sets them apart in the market. And what they were doing prior to COVID-19 and having to switch to the virtual therapy network was this amazing opportunity for first responders to come together in groups of cohorts and really be able to belong to a group and learn that it's okay to be vulnerable. We're all kind of taught to rub some dirt on it. If there's something wrong with us, maybe we're alone or weak or defective and we should just suck it up. And we know that's not true, yet we've not really done a good job of showing people how to do that. And I feel like the Battle Within really helps people understand that all of us are battling something within us. And when we can share this with someone else, we realize we're not alone. And we know that brings hope and connectedness. And that's what gets people through the day and gets people, back to finding some meaning and some hope in their life.
Lauren,
one connection for me is the number of people in my life that are afflicted with PTSD. And so for me, seeing the Battle Within and what they were doing and the real impact it was having on first responders, it was just something I wanted to make sure we could get offered to as many first responders who are out there and would want to participate.
Now, you can go to the website, thebattlewithin.org. There is a place for the Frontline Therapy Network if you want to get involved. Lauren, what would you say to folks who maybe are on the fence based on all the success stories that you've seen, that you've been a part of, knowing that there are people in your life who have dealt with this as well? For those on the fence, a veteran out there, first responder out there who may just not be ready to go down this road, pitch them.
Well, it's normal to not want to go down this road. So first, I would say you're absolutely correct, but you are not defective. There is hope. We've tried things like self-medication and other ways of getting help. And I think when those don't work, sometimes it's easy to give up and think, well, mine is so bad that there may not be anything that helps me get through this. And I just need to tough it out. And the most heroic thing that you can do now is try to get better. is try to find that support system, and the Battle Within will give you that. And just try it. It's led by veterans. It is a team of people who will understand what you're going through. And I know it doesn't feel like that anyone else could, but they can. And when you get there, just try it. It's worth it. And there's not a better group in Kansas City doing this work. So
love it. Absolutely love it.
please
Lauren,
don't suffer.
Lauren Lucht, Executive Director of Mental and Behavioral Health for the University of Kansas Health System, does great work helping the Battle Within and building what they are doing, helping veterans and first responders here in Kansas City on their journey with PTSD. Lauren, thank you so much for your time on KCMO on this Veterans Day. Appreciate all you're doing, and thank you for being here.
Thank you so much. Have a great day.